Hello everyone and welcome to Personal Profiles. I'm your host Nighat Shah. Here we delve into the lives and stories of inspiring individuals who are making a difference in our communities and beyond. Today we are honored to have Dr. Mary McDonald with us. Dr. McDonald co-founded the McDonald Murrmann Center for Wellness and Health more than 25 years ago in Memphis, Tennessee. The center provides comprehensive health care for all ages. Dr. McDonald, welcome.
Hello.
Yeah. Dr. McDonald, if you would, please take us back to your youth. As a young woman, what motivated you to specialize in women's health and then start McDonald Murrmann Center for Wellness and Health?
Well, first of all, I grew up in a very small town. Well, it's not that small. It's about 10,000, Paris, Tennessee. And I was fortunate to grow up in a medical family. My father was a physician and he did internal medicine.
Okay.
But as I grew up and I went off to college, at that point, I decided I wanted to be a doctor. And back then, as a female, we just did a pre-medical kind of curriculum.
Right.
In my small town, there were no OBGYNs. It was a family physician who did see people through prenatal care and stuff, and it was general surgeons that delivered if they had a C-section. So it was kind of an area I didn't know that much about.
Yeah.
As we go through med school, we go through all the different areas of medicine, and I was drawn to the OBGYN side of medicine because I liked doing the medicine, because I could do internal medicine stuff like my father.
Yeah.
I will also reiterate that I have a brother and a sister who are also internists at
That's lovely.
And but there are other people in the family that weren't doctors. But that aside, I also like the surgical aspect of it. And who doesn't enjoy the wonder of birth and stuff? So I think that is really what drew me to that arena. It was a diverse thing of what we could use our knowledge that we had learned in med school, number one. Number two, the skills. Some people don't have them, but I felt like that was a way I could use some of the technical things that I was able to, I was God-given to perform. So I will also say that I found that I related more to women. I mean, I took care of my share of males and going through training and stuff, but I felt like I could had shared experiences.
Yeah. Dr. McDonald, do you think it's different when women doctors are taking care of their female patients than when during their childbirth? It makes a difference?
Well, first of all, I will tell you, I've been a doctor for 40 years.
Wow, congratulations.
And I would say from 83 on, I was doing what my craft is. I was doing obstetrics and gynecology.
Yeah.
But as far as, and the majority of people that trained me were men. So I would say my mentors were not necessarily male or female.
Yeah.
There weren't a lot of women.
That's true.
And so I came out into medical practice and joined an all-male group.
Yeah.
One woman with all men, 6 men.
Wow.
And so I can't say that men and women aren't able to both take care of women and have, as far as child. I was obviously delivered by a man or whatever and stuff. Yeah. But I will say 28 years ago, Dr. Murrmann and I had the opportunity to kind of branch out on our own. I've seen the healthcare situation in Memphis change a lot over the years. And I remember when there was fee for service. I remember when there were HMOs. I remember when the teen care came around. I remember, and a lot of things like that has affected healthcare and has affected, how we end up practicing medicine, and also probably geared us towards trying to look for a way to better provide services for our patients, because we wanted to bring to the table things that women want, particularly. But I would say 10 years ago, Dr. Murrmann, I would say, has become my mentor, because she had branched into functional medicine and kind of looking at it from a longevity perspective. And it piqued my interest because having practiced medicine as long as I had, we were trained really to care for it. I would call it healthcare was disease management.
Right.
It really wasn't preventative. And a functional approach is really looking at it from more preventative. And that's why what we do and the things and the services that we've developed here.
You call it very nicely 360 degrees.
Exactly. You know, and stuff. We would rather prevent problems than have to worry about taking care of the problems. And the thing is, I mean, obviously, we have the benefit of having learned, you know, the medicine side of things. And because of I always felt like OBGYNs were hybrids because people didn't know where to put us. Because for the majority of people,
surgeons and
but for the majority of women's life, they're gynecologists for the people they went to.
I agree totally. I mean, when people ask me who's your doctor, I say Dr. McDonald because I don't even remember my family physician.
Yeah, well, we kind of been that constant because, and that we can blame that on insurance and stuff. You have to. I don't understand why women are being, I guess, forced to pay a lot out of pocket for medications that have been around for a long time to help their quality of life, particularly the hormones.
This is such an unfortunate thing for women. I mean,
and I think, and it is, but you know, we always used to, I guess we kind of look at big pharma, if you want to call it that, and stuff. The problem is insurance companies contract with pharmacies and they choose a formulary. And that formulary locks you into what they'll pay for. And some people, our money is tight. And so they have a hard time paying out of pocket for something we may feel might be better for them, like a compounded ingredient or a pharmaceutical. And they aren't able to have access to that, or they are, but without a big cost to them. And that's unfair. That's how I look at it.
And every year they're increasing their premiums and they are decreasing their offerings. Dr. McDonald, can you share some of the greatest myths about women's health in their 40s and 50s, and how do you debunk them?
Well,
especially about women's health pre and post-menopausal time, and also about their aesthetics, and what are your thoughts about using aesthetics, including Botox, fillers, and all these other things, because we talk about comprehensive healthcare, overall well-being, and also confidence.
Perimenopause, menopause is I guess something that women of my age probably never talked to their parents about, or their mother, I would say mother about, because that generation didn't talk to us about those things. But so as because of where women are more vocal now, they are feeling more comfortable, and there are more women physicians, because I hear it all the time. Some women don't feel comfortable talking to their male physician or their family or their medical internals. You know, they love their medical doctor, but they don't feel comfortable talking to them about sexual issues and or that
more intimate problems.
Right. And so as far as the things that, you know, everyone wants to know, you know, when is it going to happen? How long am I going to feel this way? You know, why am I gaining weight? You know, why do I need to take hormones? You know, those are things that, as far as, you know, to think that, you know, that menopause makes you irritable. Menopause, you know, you can't sleep. You know, menopause, you can't, you know, those are things that, as a physician who does this kind of healthcare, you know, there are solutions for these, and letting women know that, you know, this is when the average age of menopause is 45, when people go through menopause is 45 to 55. There will be some women in their late 30s that will start developing symptoms, and in their early 40s. But those symptoms are night sweats and hot flashes, but your irregular periods are probably the things that start bringing people in the first part of the process and stuff. Why I'm skipping cycles, or what's going on here, or they're coming too often and they're heavy and everything else. And these are all can be due to imbalance of hormones. And those are things that, you know, as gynecologists and stuff, we are trained to, you know, listen, find out what's going on, and figure out, is it a structural, is there something wrong with the equipment, or is it that it is a hormone issue?
So it's recommended to come and see the doctor when you see these first signs.
Sure. And so, and I think reassuring patients is probably 90% of what we do, is that what they're feeling or what they're going through, you know, there is a reason. Or if it's not a problem, you know, and stuff, it's not menopause. Are you stressed? Is there something else going on?
Are you sleeping well?
Yeah, you know, there's a lot of things that, you know, people always come in, they want to think it's their hormones or whatever that's causing the problem. And a lot of times it's because we aren't, you know, I guess, de-stressing enough and
That's
everything.
Lovely. Dr. McDonald, thank you so much for all this insight. And I want to ask you about, you said you are coming from a physician's family of physicians.
Yes.
So did your kids follow your footsteps?
I have a daughter who is a doctor, but she followed her father's footsteps and is an interventional cardiologist in Houston, Texas.
That's lovely.
So she actually went off to med school saying she was going to be a gynecologist, but the heart was a lot more interesting to her. She actually, you know, went that way and stuff. And I'm very proud of her and what she's doing. And, you know, when you become a doctor, you have to have a passion for what you're doing. Of course. And, you know, that's the key issue.
Yeah. Otherwise, it's a tough job.
Yes. Can I make one other thing about just in general about what we do here at McDonald Murrmann and stuff, is that we like to view ourselves, and I hear it from my patients, they like the idea that we're a one-stop shop, that they can come in here and feel comfortable talking about their health and their wellness and their journey. I always say health is a journey and not a destination. I stole that from somebody. But I loved it. I heard it. It's my mantra and stuff. And I feel like I have to, if I'm going to talk the talk, I've got to walk the walk. So I've always stayed active. I've always, it's hard to tell people what they should be doing if I'm not doing it myself for the most part.
Yes, you have to walk
But things that we do here, we do focus on, hormones. We do focus on wellness screening. We do, and that we do offer the weight loss. And as you said, nutritional information, IV therapy, aesthetics. And the thing about, you asked about earlier about Botox and everything, I think that in 2003, actually, we started our aesthetic side of our medicine program. And we did it because we felt like if women liked what they see in the mirror, they're going to want to take better care of themselves.
Of course.
And, and it's not all about what's on the outside, but if you're taking care of yourself and then your health is going to be better and stuff. I do feel like, that we do try to make people comfortable, and you decide what you want instead of us telling you, oh, you need this, 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 and this. And stuff. And I think I've always felt like that, I think most of us just want to look like ourselves and stuff.
Agreed.
And if we can do that, and then if we can do other things like supplements or anything to keep us not undoing what we've already done and taking the advantage of the lasers or the whatever, the treatments that we have as far as the radio frequencies and things like that. And, as far as whether you choose a medical field or whatever and stuff, it's a different kind of journey and stuff. And as a woman, I can say that, when I was interviewed to go to med school, I was asked by a male interviewer, don't you want to have a family? And I thought, wow, yes, someday, but that's not what I'm here for.
And here you are, a proud mother,
I
proud
have 3
wife.
children. They're grown, and I have almost 6 grandchildren. I got 5.5 right now.
That's a myth you just debunked.
Yes.
Thank you.
Yes, you can have a career, you can have a family. It takes a village sometimes. I mean, I can't say I did it all by myself.
No, of course.
But and I'm also married to a physician, so it's definitely that has been a journey as well and stuff. So I think, but of course we have the shared passion for helping other individuals and stuff. I was never going to marry a doctor because my father was one. And I thought, oh, they work too hard, and stuff. But, that's not always the case, And I think nowadays we all want, not as far as a medical career and stuff, you like, life balance and stuff and everything. And you have to take care of yourself.
Of course.
It always comes down to, you can't take care of other people if you're not taking care of yourself.
Yeah, it all comes down to who you are, what can you do, right? If you don't take care of yourself, you can't take care of other people. And I want to quote my favorite writer here, Dr. Wayne Dyer, and he says, you can only give what you have. So if you don't have love for yourself, you can't give it to others.
That's true.
So if you're a doctor,
but we love everybody here at McDonald Murrmann.
That I know. I have been here, and I have been your patient for the past 24 years now. So
you're dating me. No, I'm kidding. No, it's been my honor and my privilege to have, I guess, taken care of so many women through the years and stuff. And that's where I'm humbled when people, take the time to tell me that. And I appreciate, that you stayed constant with me.
Oh, of course. You've been an amazing doctor. Dr. McDonald, is there anything else you would want to tell to our audience?
I just want to stress that, for women's health, be confident in the person who's providing you the information about how to take care of yourself, and that you should always research and make sure that you do feel comfortable with whatever services that you're getting and stuff, and make sure that it is the right thing for you. And that medicine is not a cookbook. You can't just go in there and pick this, and it's just a recipe that everyone's going to feel the same. And realize that, a lot of times women come in here and their best friend has done this, and that, and you have to say, but you're not your best friend. We are all individuals, and we look at medicine as it's a personalized medicine, and we try to figure out what's the best for each individual. And I think that's what all women should be looking for as far as their health care, especially when it comes to women's health.
Beautiful. Thank you so much, Dr. McDonald.
Very welcome. Thanks for having me.
It has been an honor. And to our viewers, thank you so much. Until next time, take care.